report.
Well, welcome everyone. It's our sparsely attended meeting, I'm assuming because it's the middle of July and people don't do what they don't feel like doing in the middle of July, I've noticed, especially in Oregon. You're on vacation? Well, why are you in town? Well, that's what I would do, I just hide.
Yeah, I'll try again. Thank you for spending part of your vacation with us. Yeah.
Yeah.
You know, I'm getting so many thanks for my vacation. One day I just
hiding your stuff.
What are you doing?
I was supposed to be on vacation last week to go to my class reunion, and it got canceled because nobody bought tickets. Like 15 people bought tickets.
Oh no!
So I've decided that it's because of Facebook. We all can see each other all the time. Yeah. Want to or email or whatever. In Albuquerque.
Oh
wow!
So we were going to road trip down and then fly back, and then I was just like, you know what? It's canceled. Let's just save the vacation for something else. And I sort of regret it. I should have just stayed here and did staycation. Does everybody know each other? We all know each other. Yeah. There she is. Hello. That's okay. We can introduce ourselves again to Megan.
Hi, I'm Megan. Training system director. And apologies for being late, but the accident on Highway 38, and then it just becomes a very slow-moving funnel with a bunch of semi-trucks. Thanks,
You're welcome. We were just doing introductions and lamenting our sparsely attended meeting because of it's July.
Yeah, having meetings in July is hard.
Maybe next year we won't have this July meeting.
Yeah. We were so busy out there.
We were. Talked about porches and people's houses. Joyce is supposed to be on vacation, but she's here.
Oh, well, that's really nice. Yeah.
The whole month you're on vacation?
You know, you guys could have canceled. People could live their lives.
I mean, no one wants to live their life. Yeah, okay, so we'll go through Megan's presentation, we'll do our Q&A, and then maybe we'll get to we'll kind of end early, and you should turn your phone off.
No, I'm just down here. Why not? I mean, I'm going through all this effort to come downtown.
Kidnap her and take her somewhere.
To spa day? Take her to the spa day?
Don't put that on the record. I'm not kidnapping this boy. Are you one of those people who, like, when you retire, too, I'm retiring, working only 30 hours a week?
Yeah.
I got a line of people who are saying, we can't wait till you retire. We have the things we want you to help us with.
17 boards for you to say. Right, she did the introduction.
Sure, we could do quick intro.
All right, I'm Carmen Ellis. I'm with Child Care Resources Referral in Sonoma County. Oh, great. I'm Michelle Hibbard. I'm Ed Director at the Children's
Joyce here, education on the left.
Carol.
Eva. Oh, okay. Is there anyone on the phone?
No, just Teresa.
Okay.
Not just Teresa. Teresa's important.
But she's not even listening to us yet.
Yeah, she told us she's going to put her headphones down.
Oh, that's funny. Okay, well, should I just jump in?
You can just jump in, yeah.
So I asked to be able to come and meet with this committee to talk a little bit about a proposal that the division's working on for some legislation in 2017 related to professional development for early learning professionals. And we had to turn in a draft for the legislation about a month ago, but I actually just got it back and have the opportunity to do edits. So this conversation is really timely, and I'm glad that I'm having it with this committee, and hopefully you can help carry it to some of the other members, because as we keep marching towards session, there are opportunities at various points to make adjustments, and then once we're in session, there are opportunities to introduce amendments, et cetera. And I'm hoping that this bill will be one that winds up being carried in partnership with the governor's office and winds up in her budget, so we shall see. Before I dive into talking about what's in the proposal, though, I actually wanted to pose a question to the group. This proposal came out of some challenges that we observe, or some barriers that we observe, are in the way of early learning professionals when it comes to accessing both pre-service training, so university or community college level training, for those that see themselves wanting to do that and being on that kind of a career path, and then see some barriers for in-service training or the kind of ongoing professional development and support that providers want and deserve, regardless of the type of care that they're providing and regardless of whether they're interested in a professional certificate or an associate's degree or a bachelor's degree. So I've been kind of framing that up as pre-service training and in-service training. And there are a lot of really well-documented barriers, but instead of me just rattling through them, I'm actually curious what this group sees as the barriers for the population of providers in our state, especially providers of color. We have some data that shows in our workforce studies that being a person of color is actually negatively correlated right now with taking advantage of the professional development opportunities that the state has available by about 3%. And I want to hear, I have lots of thoughts on what the barriers are and lots of data on what they are, but I think it's more fun to start with giving you the chance to share what you're seeing with the populations of providers that you work with. And then we can jump into our vision and talk about some of what we're proposing.
First of all, I think their cost and time prohibitive wages in the industry don't justify getting a higher degree in early childhood. Taking time off or having flexible schedules to go to school isn't really a reality. A lot of my staff are single parents. So again, the time and cost restrictions make that challenging.
When we think about time and cost, can you unpack that a little more? Is it the cost of tuition exclusively, or is it also the cost of maybe missing work to have to go to class?
Yeah, exactly. I do have some staff who are, I can't remember exactly what it is, but it's scholarship through Early Learning Division. And so they benefit from that, but either childcare when they are in class or time off from work to go to class.
Well, one of the things that I hear is that even when there are trainings or opportunities, they don't offer the information. And so they're feeling excluded. And to a degree they are. And then the whole issue of time. I was at an AMA Alabama Head Start meeting, and that was one of the things that was expressed by a couple of people is that they couldn't afford to leave children to go participate in training. It was something that they could do. So maybe there needs to be some consideration to providing PD opportunities at times when these providers are not having to care for children.
Not doing it in the middle of the day on a school day.
Well, we're with that we're finding, we're helping. I think Marilee Haas from NACI said that they tried to do a substitute pool at one point, but it was difficult to sustain because it wasn't used as often as like the school system sub pool. But I think that there's got to be some way that we can tap into the school system sub pool for early learning too. But then we need to pay as well for those sub days as we would for at the K-12 level. But that would free up availability for somebody to come in and be there for people to take the time during the day, and that they cover the hours, pay the hours, so the employee doesn't feel like they're missing out. But I know it's a dual cost to but I don't, somehow we got to figure to the employer,
Right.
but somehow we have to figure out a way to support that, because even for after work hours or weekends, training is difficult because of the childcare needs of the person seeking it.
How ironic that you're a child care provider who can't afford child care.
Can't afford
Yeah.
Yeah, right.
I mean, there's been an article, National Jobs with Justice has been tweeting it on a regular basis, so I retweet it every once in a while. But the headline is, it's a rotation of headlines, but it's about child care providers and early learning providers that, they're often recipients of public assistance as well, or that, one of the quotes that they pull out is, a legislator tells a child care provider, "Oh, you get paid in love," and she's like, "Okay, so the next time my landlord comes, I can just give him a hug and that'll be okay."
Yeah. Will you send that article out to the group?
Yeah. Yeah. My constant retweet. I have no original thoughts. I only retweet.
Parallel thoughts.
Yes, they're parallel thoughts.
One of the barriers that we see, and I guess I see like kind of overlap between pre-service and service a lot, because people, I mean, we all know that, like because you can get into the field and into the classroom without having a degree in PE, people tend to like discover their passion for it while already working in it sometimes, and then have the question of, well, do I want to go back and get a degree in this? And one of the things that we encounter a lot is that people are not confident that they have the skills it takes to go to college. So we have having a lot of conversation in our office about things like college credit for step threes and stuff, not just to get the college credit, but as a way to show people, like,
right, that it is.
this class that you took with us, like these classes that you take with us,
Well, I think
are the equivalent of going to college. Like, you're already taking classes from college professors when you train with us, but like trying to have more of a dialogue around that to like demonstrate to people, but also asking like, what are the questions? Like for me, like what is it that people need? Like what support do they need? Is it mentoring, coaching? Is it like a crossover class that they need that's like co-hosted by the organization they already train with and one of the community colleges? Like what are they needing to show to them and prove to themselves that they can do it?
Yeah, that's a really interesting way of putting it. So a lot of times we talk about it as credit for prior learning, right? So can we make it so that the community-based classes that people are taking at the R&R count toward their associate's degree, which then needs to count toward a bachelor's degree, right, pretty seamlessly, so that people aren't having to repeat content that they already know.
Yeah.
And the way we phrased it, if you're taking courses with us, you're taking the equivalent of a college course. That's kind of interesting because the state has implemented the Oregon Promise program, which is for high school kids who are seniors to just by taking the normal classes that they're required to take, getting college credit if they're in a class where the teacher has been sort of approved by the community college as being able to teach at the community college level. It might be kind of interesting to frame our credit for prior learning goals through that same lens. And the R&Rs have employees, I think, who we would be able to make a case are qualified to be teaching at the collegiate level. And some of your master trainers already do.
Yeah, and a lot of, some of the people that we contract with to train are they're at Mount Hood and at Portland State, and so it's like sometimes the providers are like that. This person you're taking a training from like runs the infant toddler mental health certificate at PSC.
Right, you're already there.
If you just had a great dialogue with them, you just had a dialogue with a college professor.
Right.
You've already done that.
You were completely capable.
You were completely capable of.
Well, and I think for some who do make that realization that they could go on to college, they're kind of at that point of like, well, I've been doing this for 20 years. Why am I going to
Why am I?
Yeah.
Back in the
So why can't I already get credit for what I've done? So
yeah.
maybe it's not the full credit. I know that our provider, the AFSCME providers, have talked with PSU and said, why can't we have? And they're like, well, it's not the same. Give us at least partial credit,
Yeah, or start the conversation about, yes, it is. Your own professor is teaching it.
Right.
I know that has been an uphill battle a little bit with some of the colleges and community colleges on the high school K-12 side, but maybe they're making tilling that soil or making the ground a little bit fertile for other professions to be able to have the same conversation. What other barriers do you guys see in the work that you do, especially as someone that runs a child care facility, someone who represents child care, I didn't mean to karate chop you, someone who trains child care providers, someone who's worked in the field of educational research and has expertise in early childhood education. Is there anything else that you have been seeing that hasn't been mentioned that's providing a real barrier to providers themselves or to the profession being seen as a profession, which is another challenge that I think we might face?
Wages. As far as being seen as a professional, as far as having the incentive to further your education, in terms of having the ability to pay off that education once you've received it, as far as how we're seen by the world, families.
I think especially for the in-home providers, with the focus on how childcare is expensive. It's not how I like to talk about it, but I say it's difficult to afford for many families. But they also know. So our providers see and hear that in the news, and then they know that they're barely making ends meet. So they think, well, gosh, because in-home providers are going to be a more affordable choice than a center-based. But they see that and they think, gosh, I can't make ends meet. I need to increase my tuition, but I can't because my parents can't afford it. So there's this loop, and they don't know how to talk about what that, why more public investment to help keep the costs down are. They don't, and so I don't know what we can be doing to empower them to talk to people that, their parents, their neighbors, and say, look, we need a public investment in this so that we can increase the wages and, keep the quality high and, put it on par with K-12, because the reason why childcare is difficult for so many families to afford is because we don't subsidize it like we do K-12.
Yep, that's very true. So Carol's heard me say this before. I see the economics of the child care industry as profoundly dysfunctional and kind of a trap. It's a trap for parents who can't afford it, and it's a trap for providers who, if you're a family home provider, it's often the situation that Eva's describing, and if you run a center, it's a situation where you desperately want to pay your staff what you know that they deserve, what you believe they deserve, pay yourself what you believe you deserve. But that comes at the cost of increasing tuition for families who we know in Oregon are, in a lot of cases, barely scraping by. We have 50% of our children on the Oregon Health Plan, which means they're living at 200% of the federal poverty level or less. And so think about what that means for their families. And to me, it just feels like a trap. And to Eva's point, the early learning system in Oregon and every state in our country is mostly paid for by families. The last time I looked at the data, it's like 77% of the dollars that go into early learning come out of the pockets of families. That could have increased or decreased. My guess is it did not decrease. If anything, it probably increased. And it's such a perplexing problem from a state system or public policy level to think about, because this is not a country that has chosen to make the same kind of investment in early learning as is made in K-12, which is a good way of putting it, is think they're...
I mean, for good reason.
Yes, of course. I mean, everyone's
Right.
entitled to a free public education.
Right.
There may be some opportunities to do something about that or take a big step toward doing something about that in the legislative session. And so maybe I'll dive in there in terms of chunks of proposals that we're putting forward. I want to do one last check for barriers that folks might be.
Eva had mentioned subbing.
Mm-hmm.
Right now at my center, we are in a position where we're one of the OCDC EHS partners. So we have a number of staff that we're working on to get their CPA credential and to get them out of the classroom. We have a large sub-pool,
Right.
but you know, an OCDC is helping to pay for the subs to get them out of the classroom. But again, you know, just kind of sustaining that, having the coverage. We have a really large staff, so just having enough subs to cover when people are sick or their children are sick or they have vacation, and then training time on top of that. I know everyone struggled with the schools, and there was some kind of overarching way to manage that or to collaborate on that between providers.
Yeah, that is one, you know, I have heard Eva mention it before. I'm a little embarrassed to say that didn't make its way into our thinking as we were putting the proposal together and pricing it out. Luckily, it's not too late to potentially add some language about the creation of a community-wide subpool. We'd have to figure out how we want to define sort of geographic communities and put some dollars behind it, because it seems like two things. One, you probably want to have a pool of funding to be able to support business owners that need a substitute. And then two, we would need to think about how can we as the Office of Child Care just think about doing the certification in a quick manner, as quick as possible, so that there's background checked people who are available to do substitute care. So I want to come back to that, because that is not something that we have been thinking about.
I wonder if there might be people like overlap too between that sub-pool and people who are doing licensing staff care. Because if we're going to be requiring people who are doing who are FFN to have all of that training, that might be an interesting overlap. If you're if you're not caring for someone all week anyway,
right,
and you're free Mondays and Wednesdays, and you've got all that certification and 6 hours of training every 10 years, like maybe
a certain neighborhood,
and you're in a neighborhood. We would like to fill in down the street.
I know that with the subpool, because I did some just very preliminary asking around, because I asked about tapping into the K through 12 subpool, and that's definitely an issue of cost. But then we also had to bring in OEA and figure out how contractually that would work. And then the providers have said, well, I want to have people that I know. Because, you know,
inviting a stranger into your home to care for children you know that you're on.
Yeah.
That's not going to work.
Yeah. So I mean, there is a complication. So how do we get providers comfortable with the sub so that we have some sort of, they're not just calling somebody they don't know, but you know, is it an FFN provider that lives down the street that they do know and they see at the park on a regular basis and they know that they're comfortable with their style of.
So then the center, you have funding to do a working interview. So you have, you know, you hire someone to be a potential sub, or you then you have them come spend the morning in a classroom. You can see how they actually interact with children, and you know you want them to be there with you all day. But if you're a provider, you might not have that.
Right, and the last thing you want is like for your unannounced visit to happen on the day when you have a sub that who hasn't got people signed in properly, or you know, like, cause then that's the providers.
Yeah.
Well, one of the things that I heard from is that she is really reluctant to have someone come and look after her kids. You know, they develop a real close relationship
Right.
with the children, and you just don't trust your children, anybody.
Right.
So I think that's an important part. There needs to be someone that the provider can get to know someone or just feel comfortable. So this woman, she was at this meeting, and she said the only reason why she was able to come is that her sister, who also was a provider, came over and watched her children. She said, otherwise I would be here because I just can't trust my children.
Right.
And I mean, that's the kind of commitment you want. Care about your children. The children that they're watching, they care about their own.
Yeah. Oh yeah. They're all
Oh,
their
I know.
babies.
Yeah. Yeah.
Can I piggyback on that?
Sure.
I feel like one of the things that I really have liked about the network structure that we've been doing a lot of. I don't know if you all are. There's a lot of provider networks that are going on. And they're really successful, and a lot of people want into them. Like, we just started up a second topic network, all Russian-speaking providers, and we didn't have to do any recruiting. Like, there was already 15 people waiting to be in that network, and it's the same. Yeah, it's the same for the Spanish network. Like, people are calling all the time, being like, "What's this thing where I get to come to dinner and there's training?" And the people are hungry for that professional development. And one of the things that I think is so amazing about it is that they have a chance to build relationships with other people, and I see that as one of those links where you can get to know. I mean, you're, instead of being in isolation in your home, you're meeting other people, and you're having a chance to potentially meet other people who might have a friend who can sub for you. And there's lots of different ways I think it will grow that we haven't maybe anticipated beyond the growth of that individual. And for me, I would love to see that be available in all of the languages that we train in. Right now, we're at 3 out of 5. We're expanding to Somali language training, so I can get 3 out of 6 right now. But I think that within all of those languages, that there are people who want that experience.
Yeah, just what I'm hearing and what it seems like, and actually I think this is important in a lot of ideas that we have and others have, is to not treat family child care providers like they have the same circumstances as providers who work in centers.
Yeah.
Because I think you said it, a center might have the ability to do a little more vetting on who they want to have substituting in their classrooms, whereas family child care providers really want to and have to know the people that they're inviting in. So I wonder if we, anyway, this is just me thinking out loud, since I obviously haven't adequately thought about this particular issue. But I wonder if there's a pot of funding that we could ask for and advocate for at the legislature. And the price of admission on that is that you're a provider who is working a professional development plan. And then we could say, if you're a family child care provider, we want you to choose who your substitute will be, and then pay them and pay you for your release time. And then centers have also the opportunity to choose who their substitute would be, instead of trying to necessarily create a sub that we just say, here's the list of names that you can choose from. So, we probably would need to have a vetting process for, or a list of requirements that you have to meet in order to be a substitute, so that we know that you're a safe person for kids. But then we actually could just say to the provider or the center, here's the funding that's available to you. You or a member of your staff is working a professional development plan toward a CDA or another type of professional certificate or associate's degree, and we want you to choose who your substitute is. Here's the list of requirements that they have to meet, and here's the funding that's available to pay them and pay your release time. Instead of trying to say, here's just the list of people that you can choose from.
And
that might
that
be
happens in the world of teaching.
Yeah.
Because, teachers get to know which substitute.
You get your 2 subs in that
Like,
so,
yeah. And
Good point.
they ask, I want this college. I know people have changed the days that they were going to be out just so they could get that particular.
and so they have that autonomy. A sub has met a list of criteria and gets paid, and the teacher in that case most likely is using vacation or paid sick leave, which we don't have in childcare, and has the autonomy to choose.
Trains maybe
really
now because they have to. In
Oh,
Portland.
yeah, in Portland.
Yeah.
Another interesting problem that drives the cost
My
of
niece
care.
is a special ed, used to be a special ed teacher down in California. She's retired. It seems like she's working for now, but she was in the classroom because parents love her, you know, and they request her.
Yeah.
You know, it works out well for both sides.
Yeah.
And she tends to sub for the same teacher, so the kids know.
This is really cool. I'm so glad that I came today because this group has basically developed an additional component of our policy and funding package. I gotta put a little more thought into it since we're all kind of brainstorming and thinking out loud. But I may just go ahead and draft something up and add it and then have you all look at it and see, is this exactly what you were talking about? The other thing that's so interesting to me about that and why I am glad that I came here and love that we're working to bring in multiple perspectives is that no other group that we've talked to so far has brought this issue up or to our attention, which is why it's not part of the package. And our staff haven't thought of it either.
The substitute piece?
Yeah.
I've been thinking about it for years.
Yeah.
I just haven't been able to
Just figure out the mechanics.
Yeah, figure out mechanics of how it would work to be able to say, okay, this is what
Yeah.
we should put forward. But it especially became clear to me that something needs to be done with sick days.
Somewhat of a model for this through a program that North Carolina started called TEACH that I'm not sure that we're going to work to bring that model to Oregon or just crib the components of it that make sense for our state, but using work that other people have done to see what works for them and if it works for us. So anyway, I'm so glad that you guys brought this up.
And I think choose the culture specific. Right. So that's really important. That would be appeal to
And making sure that when we have that, we have providers that have years of experience mixed in too, because I know that they help each other. There was an incident about DHS statements. Somebody was doing it all wrong and they got in serious trouble. And a couple of the providers I know were like, if I had known she was doing that, I would have told her. Like, oh man, she was doing that all wrong and we would have told her.
Yeah, there's professional development with a capital P and a capital D, and then there's professional development from peers.
Yeah.
That just, you know, you're my colleague, I want to help you.
Yeah. Like, oh, don't do that. That's really wrong.
Sometimes the community and learning community is like biggest.
So can I share some of what we're talking about just kind of go chunk by chunk and see if what we're doing or thinking about doing begins to address some of these barriers and what we might want to add, like the conversation we just had. I do want to say the things that you have all brought up are pretty familiar to the profession and are entrenched and have been there for a long time. And there has never been, in my opinion, adequate focus at the national or state level to try and address them. And in Oregon, there's never been a general fund investment in the kind of professional development that we're talking about. In the last legislative session, we did get $2 million to put toward Focus Family Child Care Network, which is what Carmen was talking about. Did I get that right or did I?
You're right.
Okay. I'm sorry, I learned it after the end of a meeting, but in the beginning. So we did get $2 million for Focus Family Child Care Networks, and we do have a state general fund investment in subsidy. And we had $4 million, $400,000 put toward a professional development consortium strategy I'm going to talk a little bit about. So it's probably unfair of me to say there's never been a general fund investment, but it feels like there never has, because those are scraps that have kind of gotten thrown to the division compared to investments that have been made in other fields, other professions. And so we're putting together a package that has a big ask to it. We've been saying the number $15 million for professional development and professional support for the early childhood community. And we may want to up that number based on the conversation we just had. That's a big number for the legislature to contemplate for a problem they've never thought about solving before. Our vision is that we have providers who have access to the kinds of training and higher education experiences that they want and that make sense for their lives. That populations of providers who have been systematically left out of the opportunities that are available in Oregon begin to have access to them in a way that makes sense to their community, to their culture, and in a way that feels safe. That the work that we're doing to put those opportunities together work for people, not institutions. We need to serve the needs of the providers that we're talking about, not the institutions of higher education, which is a hard thing to think about, but it's part of our vision. And we need the early learning field to be compensated at the level that it is compensated at, that the people working in the field begin to feel that they can stay in the profession over the span of a career, and that they are being compensated in a way that gets closer to what they deserve, and in a way that gets closer to showing a real sense of value for the profession, where you're not getting paid in hugs. So that's the overarching vision that we have. I'm going to start with the piece around wages, which connects to what we're talking about, but will be its own kind of separate budget line item. And I'm getting kind of into the weeds of the legislative process, because I'm hoping that the more that you know about it, the more that you can help us build a coalition of advocates that will push for it and keep the issue at the forefront in a session where there's going to be a lot of competing interests in the education field, but also human services, also corrections. Everyone feels like they're devastated and don't have the resources they need to do their job. On the wages piece, because the early learning profession is primarily a private regulated market, it's a barrier that's taken a long time for folks to start to figure out, and truly I don't see any real solutions coming from anywhere around the country, except for child care subsidies that are available to families and to providers. It's not, it can't be the only solution, but it is the one that we have right now and the infrastructure that we have right now. I believe that we need to see an investment in child care subsidies in Oregon around the level of $100 million in state general fund. I know that sounds like a really shockingly big number, but if the ballot measure that's on the ballot right now passes, the early learning community needs to fight and put their thinking of the level of investment that should come to early childhood in the neighborhood of $300 to $350 million. So if that's the case and those monies do wind up existing, $100 million into the subsidy program goes a long way toward being able to expand access for families. We're currently serving 16% of the eligible population. That is unacceptable, but that is the dollars that are in the system right now. And with subsidy, there's a benefit to the provider that begins to raise the wage that they're able to make. You guys know this, and there's a benefit to families. So I think connecting the dots between access and then making quality really pay in a systematic, ongoing way by making the quality incentives that are available right now actually feel like they matter. Right now, at a 3-star, you get $50 extra a month. Is that correct? 50? You would know this actually probably in more detail. A small amount.
Yeah, right, for full-time, for a full-time child.
Yeah.
Yeah.
It's a small amount, and if we want to help child care providers and preschools be able to sustain the level of quality that we all want for our children, there have to be incentives, really true incentives tied to that work that go on. We've been able to invest in kind of startups, but that doesn't help keep it going, and it's an inadequate way of thinking about it. So I'd like to see an investment in the subsidy program that expands access and makes quality pay, and I think it needs to be around $100 million. And the state has the infrastructure in place to make that investment. Not always perfect. The direct pay unit at DHS, with which we help fund and partner with, is not always perfect. FEMA's
some real issues right now.
FEMA feels like it's rarely perfect or rarely adequate, but there's improvement that probably needs to happen there, but it is an infrastructure that those dollars could go into. That's kind of all we've got on wages right now, and I wish that I would have been able to find a different or a better solution, but talking to colleagues and technical assistance organizations across the country, the conclusion that I've come to is that America needs to decide that we're going to pay for early childhood education in the way that we pay for K-12 and in the way that other countries pay for it.
I think if we also remind people that the investment in early learning helps support the school-age children too, because child care doesn't stop at kindergarten. So I think we need to be clear that not only is it preparing kids for school, but for those who need care before or after school, it's sustaining their success throughout at least 6th grade.
On the in-service, so that's wages. Like I said, it's inadequate. I'm curious, just reactions in general. The big number last session, we got $49 million in state general fund new into the subsidy system, and even that felt like a huge win, and even that was just not enough.
And I said so on the record, and got that.
But it wasn't enough.
Yeah, I said it wasn't enough. That it wasn't enough, that we were only going to be adding less than 1,000 families to the employment-related daycare rule. And I got, yeah.
a place to keep.
Yeah, we do need to remind people that for the mindset is kind of the like, well, you get paid in love, or why should we even care about this? Or we did just do a big investment of 40, whatever, and for those people, they do need to hear from as many people as possible that this is about childhood success. It is about moving people out of poverty. It is about, making important investments and not putting the burden on so many families that are already struggling.
I have a question from the provider perspective. If there were more dollars in the subsidy system and more incentives, do you think that more providers would be interested in actually accepting subsidy, more willing to take subsidy kids into their program?
I think so, because I think for the ones who take subsidy, they do so, especially if they're in communities where they see it. Most of the providers that I know that take subsidy have more than one kid. So when Bobby shared with me the data that a majority of providers only have one subsidy kid, all these numbers, I'm like, wow, I live in some sort of bubble because these numbers don't like, really. That's what we have. This is the breakdown that we have. But I think that for those who don't take subsidy kids, it's because they know that they're taking it at a loss, and so they can't figure out how to make it work without charging private pay families more. And then for a lot of the subsidy in-home or providers who do take care of subsidy kids, they don't charge more than the DHS rate, because they say to me every time I challenge them on that, well, my families can't afford any more than that. and they're not comfortable asking families about income to do a sliding scale, or so I don't know how to help them ask for what it really costs to do care, or encourage them to, because Marilee does a training. I'm sure that there are other trainings through CCR&R that, that talk about figuring your true cost of care and charging that. But I think if we were paying at a higher rate or closer to the true cost of care, that more families would, especially in the rural areas where there's a significant decrease, because there are the 3 areas for DHS reimbursement, and we're in rate area A, and for an infant in a certified center, that's $1,000 a month. But then in B, it's $550, I think, for an infant. And the cost of, labor are not that much different. And I don't know. I mean, it'll change a little bit with the minimum wage scale. But yeah,
I'm wondering if there is a way. I know there's a way. I'm wondering if something that we should do is to communicate to people who are not accepting DHS subsidies, because that's in the database. It's a button that's clicked off, so you can pull a mailing list or pull a list of everyone who is or is not accepting DHS subsidies. If there needs to be communication with them about the fact that, like, now there are these quality incentives, because that information goes out, but it doesn't necessarily go out targeted to those people in like its own mailing. Like, did you know that this is available now, and these are the steps that you would take?
Yeah,
Right. We're trying to increase that.
A really interesting communication idea. Carol, writing down. The other thing that I have been thinking about is that it doesn't always go out from messengers that are going to be necessarily paid attention to, and it doesn't go out enough times. Like, I think about when you're doing a campaign to get someone elected to office, you try to make contact with them at least 3 times, and ideally enough times so that they're really, really sick of hearing from you. And the messages come from different places. So I would just imagine if I got a letter from the state, I might read it and forget about it. In fact, I know that because I get my letter about the Portland Arts Tax and look at it and then like throw it away because I know they'll send me another one, and then look at it and like throw it to the side. I always pay that thing late. I know it's being recorded, but that's okay because I think I'm in the majority there. So when you get like, I get stuff from my doctor's office that I know is important, and then I just forget about it.
sending letters.
Yeah, if I got,
we have a quarterly newsletter, and people send things, we solicit, like, okay, what do you guys want us to tell you about? And we send it out, but I feel like sometimes people think of that as like, now we've told everyone. I'm like, okay, but it's in like a 14-page newsletter on page 4. Like, if you just opened it and went straight to the training calendar, you missed the update from about QRIS being an incentive. So I think you're totally right. Like, it needs to go out in different ways. Like, if it's a priority to us that there is more affordable care, more people are offering affordable quality care, then we need to also prioritize communicating that whatever we need to make it happen.
And it's a problem. Like, I'll take myself for example. I never really thought about child care costs. And my mouth was kind of like, what? And it kind of got to the point where there were a couple of considerations that our family made. Number one, my son-in-law said very clearly, told my daughter, if mom can't keep us, nobody will. And so he decided to take family leave, and he enjoyed it so much, he told her, he said, you know what, I'm going to take care of it. And so, as a family, we kind of came together and figured out, what my husband and I figured out, what can we do to help support them? Because, frankly, I love the idea that, her daddy was going to be taking care of her. And then when they had the second one, I asked him, so what are you going to do? Well, what do you think I'm going to do? He said, I got it. And here you got a 2-year-old and a 1-year-old. They go to school every other day, and take them on field trips. And I mean, it's just wonderful. But we know that there are people in situations based on what we've learned about the cost of child care who couldn't afford to do that. You know? And so I guess what I'm saying is that it's a public information issue. People just don't know. They don't know the cost of child care. They don't know about quality issues related to child care. And I don't think they really pay attention to, everybody talks about, well, you know, they need to be prepared before they go to school. Well, where's that preparation going to happen if you don't have, you know, a parent who can afford to stay with the child and teach them? I mean, my son always telling people, my granddaughter was a year old. He put her in a ballet class. And when he introduced himself, he said they wanted to know, well, what daycare did she go to? He said she was being homeschooled. She was like a year old. And, you know, people don't think about how important that is. You know, we talk about kids not coming to school ready to learn. But there's that gap there. What is our responsibility as a society to make sure that children have, all children, some children are going to get it, folks can afford it, or know how important it is. Right. Some people, you know, they, particularly your younger parents, they figure, well, when they get to school, they'll learn all that. Not understanding that when they go into the classroom and they don't have those pre-reading skills. I mean, we had a kid when I ran my school. This child was 5 years old and she could not use a pair of scissors because they figured when she got to school, teachers teach that. And then you had other kids who could, you know, run circles around this child. So I think we need to also, when we talk about information that we send to the providers, we need to get that to the general public. You know, we need to have people talking about it in the church. You know, some of the churches do run programs, but I mean, it's almost like remind your congregation how important for their children or their grandchildren to know these things before they get to school. So it's, I'm just appalled at, you know, what I've seen over the last couple of years. You know, having had my interest in early childhood really peaked because all of a sudden, you know, I'm looking at, wow, this is amazing.
It's interesting too. So I'm going to put a period at the end of the sentence on wages right now, and then we can come back to it if we have enough time, or in a follow-up conversation. I think increasing subsidy is a big focus of our strategy right now. Communicating it through multiple channels, including I think the unions and then the organizations that child care providers have is important in really having a strategy for that. Ms. Joyce, what you're bringing up right now, it's really interesting to contemplate the choices that your family makes, because a lot of families in Oregon do make that choice either because a parent wants to stay home and is able to stay home, or because they have access to some kind of informal care, family, friend, and neighbor care. The federal government is requiring us now to regulate family, friend, and neighbor care, which is weird to me and hard to figure out how to implement, have training requirements attached to it. And there's been a lot of conversation in Oregon for a long time, and I think I've been hearing about it since I started working for the state around what are you going to do to really support the informal child care marketplace? Like what kind of training, support, et cetera, works? We have put dollars into our legislative proposal to build up strategies that can work for the SSN network of providers. I will say I think it's kind of the finished part of our of our thinking right now, but it's not. What we're thinking to do is to model what the state funds off of some work that Seattle has done to create a training network that is actually pretty informal training. It's play and learn groups. It's places where providers can come and get have some learning opportunities, but also learn from each other's shared wisdom. And we'd like to see the bulk of those dollars actually go to culturally specific organizations where the trust is built up or could be built up. For FSN providers, that's where many children of color are cared for, and especially, I think it's true for any human, but I think especially for somebody who is an informal child care provider, trust is really, really, really important. And I think that those supports need to be delivered through organizations where trust already exists or could be built quickly, instead of trying to persuade, no, for real, this is a safe space for you. Another model that we're looking at is actually the model that Kairos PDX has developed under Khalid's leadership, where she has developed a group of FSN providers who work in North Portland and care for the younger siblings of children who attend Kairos right now. And she's really grounded that work in the shared wisdom of the group and having them show up, having them start to talk, and then pointing out areas where what they're doing actually connects to best practices and research in early childhood education. So they don't start with, here's all the research that I could present to you, which is quite overwhelming. It starts with, what are you doing? And validating that, wow, you are doing so many things right. And look at how that connects to the standards of what we want children to learn and know how to do, and look how that connects to what brain science tells us. So it's a really strengths-based way of approaching it. And I'd like to see us figure out how we invest in that and start to scale it around the state. I think it'll start because it's a new kind of investment, and then build up over time. So that is the strategy that we're thinking about for supporting that part of professional development for FSN providers. And I kind of think about it as a network for providers, whether they're currently receiving subsidy or not. For providers that are receiving subsidy, the new federal requirements have some very specific kinds of trainings that they have to get, which the Child Care Resource and Referral Network is gearing up to be able to provide. And they also have to have inspections done in their homes, which talk about trust. If you're an FSN provider, having someone from the state show up in their state car with their state badge, that's really scary. We're working with our licensing specialists to really shift their mindsets away from just straight compliance to compliance plus support. Obviously, the state has an obligation to make sure that our rules are being followed. But in the past, the mindset around regulation and compliance has been very much regulation and compliance. We're trying to keep to that important part of our work and build out the way that our providers think about helping, or the way that our licensing specialists think about helping providers understand what it means to come into compliance, and if it's somebody that's interested in building themselves up, building their knowledge up around children's learning and development, actually starting to have more of a system of referral to child care resource and referral or other training opportunities that are available, which is going to, in saying that, is going to have me switch gears into investments that we want to make in community-based training in a moment. Before I do that, I'd like to see what other things this group believes we ought to be thinking about, in addition to creating basically focused networks for FSN providers that would be provided primarily through culturally specific organizations where trust already exists. What else ought we think about?
For me, I think it's just really important, and I'm sorry, this is just echoing some people. already have at the forefront of their mind. But for me, it's always really important to remember that those FFN providers, we call them providers, but to most of them, they are friends and family and neighbors of.
They're providing flexible
They
care.
are
They're
people who are
on-call.
taking care of their neighbor or their friend or their family's child, and that can cause a lot of confusion among people who want to give them training or provide professional services. They're like, you take care of kids. I bet you want to learn about literacy, and like some of them really do, and some of them are like, well, actually, I'm just doing a favor for a friend, and I'm getting paid for it, and I'm bringing this child with me during my day, and their agenda is not
Our agenda, yeah.
Sometimes we're like putting this an agenda on them, and it's confusing because we call them providers, and they are health care providers. They are caregivers. So I think it's important to remember that. And I think I really like, Megan, what you're saying about more like meeting them where they are.
Yeah,
I think that we have to do in all of adult education. Obviously, we all know that. But I think especially with this group, to be really aware of, but yeah, they're not someone who took a job at the center. Yeah, or they've taken that step. Like that indicator is not there. So I think that looking more carefully at what it is that they might need or want, and giving them that. Like not deciding what we think they need, but actually listening to what they want. I know at Clarington Regional Learning, they do like an art studio once a month. They do story time, and the idea is that that's like a kind of respite for those providers. They can focus, they can bring children there. They can, and at the same time, they see like some modeling of an interesting activity. They're not familiar with that, but it's a service for the child care provider.
And that brings up another point. So like, the girls go to the Midland Library at the time. Sometimes people take them to check out books, and so he's looked at, just things. I mean, he researched. He has, when the first one was barely a year old, he was saying, yeah, I'm taking it. I said, you need a calendar. He said, Mom, I already have a calendar. He pulled up his laptop and showed me a calendar of things they were doing, which days of the week. And, and then he talks with me and said, Mom, this little girl, she knew colors, numbers, everything by the time she was talking, because he spent that time with her. And now they're doing that with the little sister. And I think that I'm thinking about people who are in a position like that where they're taking care of families would feel almost intruded upon if people would have come and started telling them, we need to do this, what about that? I mean, particularly in the Black community, I know in the Latino community, a lot of the communities of color, grandmas were the ones. And the grandmas often didn't have college education. Some of them barely had high school education. But they were able to, they understood the importance of the kids learning their names, how to spell their names, their address. I mean, all of those things. And nobody had to come in and tell them.
Right.
They would actually be involved. I could see my grandmother say, you gonna tell me how to raise my grand?
Yeah, get out of here. Right. Make sure you keep some of their name and their address. Yes, thank you.
I think we need to look at how do we educate people without insulting them or making them think that we know best, that the system knows best. Sending information. Like my son-in-law, he peruses the newspapers and sites. And, he might call him, Mom, will take you such and such a place. I find out about that. And, what's really interesting, I found out he was able to connect with some other African-American men who were taking care of their children. And they formed an informal network, and they keep each other informed about what's going on. And so, I just think it's just amazing, to see what has evolved out of, just this little small group of Black men who ended up finding themselves at the park around the same time. And my son-in-law said, well, why don't we take them to the zoo? One day a week, it's only 2 hours. And, so those are the kind of informal things that we may not even tap into to see what are they doing, why is it successful, and what is the benefit for the child.
Yeah.
So I think that's something.
Not being intrusive, being supportive, and it's an invitation. That's a beautiful way of putting it. It's an invitation, and you can take advantage of it or you cannot. And either way, no judgment. And it gets me kind of excited to think about how what you're saying, Joyce, and what you were saying, Carmen, could really take off if we could support organizations like BPI, like Kairos, like Albina Head Start. Frankly, I see them as potentially primed to be a major professional development delivery system because of the trust that's been built up in the community. There's other Latino network, NAD. I'm being obviously very Portland-centric right now in my knowledge. On the North Coast, Mid-Columbia Hispanic Council. Like there are ways that we can think about, again, investing in organizations that have the trust to extend the invitation. And I also have wondered a lot, I think CCR&Rs in some communities have the trust to be able to extend that invitation. I've been thinking a lot about the role that we could have in truly partnering with the unions who know their providers really well to extend that invitation. I know that hasn't always been a conversation that people have been always open to around training, but I just think it's interesting. And Carol, it might be good to have Karen Garcia come and continue to dig into this conversation. So for folks who don't know who Karen is, we hired her at the division to actually be responsible for building out how we at the state can support exactly what we're talking about. And she is one of the most thoughtful women that I've had the chance to get on our team. And she came to us from SEIU, which is the union that represents family, friend, and neighbor providers who receive subsidy. So there's deep knowledge and understanding. What you've just provided is a way for us to think even more deeply about how we talk about and how we really think about implementing those supports with the dollars that we're requesting. And I would love to have Karen come in and hear this and also share what she's thinking about more deeply. Because one of the things that's not the greatest about my job as the director is I kind of float up here. I know the vision that I'm guiding the division toward, but the members of my staff are actually way smarter and way more knowledgeable about the topics that we're talking about than I am. So I think having Karen come could be really great. Am I doing okay on time? Do we end at 11?
We end at 11. We just have a Q&A and plans for next meeting, which I think the plan might be next meeting in August, maybe in August. But
well, okay.
I'll be on vacation.
This always happens because the proposal is so big and the college, community college stuff is so big. The last time I did one of these, it was flipped and the group started with that. I just kind of went with where I felt you all were going. And it took the whole 90 minutes. And then I was like, okay, I'm going to have to come back to talk about the other chunk. And so that might be the case here as well. Just let me know where y'all want to go. Because the next thing that I wanted to talk about was, and get feedback and perspective on, is what it would look like to put more support into the training infrastructure that exists for our licensed child care providers. Before I go there, though, Carmen, it looked like you were kind of leaning forward with a comment.
The thing that I just wanted to comment on is that I think it's going to be really, I would like to see as we move into giving funding to even more organizations who are culturally specific and more out in their community have those connections. I think that's amazing to just have more funding and be putting out different places and have new strategies for us to keep communication though between the organizations that already have those relationships and continue to make use of that. Like at TCRNR, like we have all these relationships and we have all this data that we're really lucky to have. And one of my like fears, I think the only like apprehension I have about like putting money over here is like, okay, but don't do it without like let us tell you some of the things that we know about this organization, and you can take it or leave it, our opinion and our experience, whether it's relevant, but don't like forget that there's already a structure built to help with that. Like sometimes I see people doing projects and they're like making, like we're going to make a new map or we're going to try to make a mailing list. Help you.
So you could actually save them the time.
Yeah, like we have a map and we have the data, and like we're happy to like give it to you. Like that's we are a resource. Like we don't have to be
in your name.
It's in our name. I'm like we don't have to be like doing your project. Like we don't have to be the trainer or the one in charge of it in order to be the resource for that. So I just feel like as we're like really pushing to serve more communities, we also need to make sure that we're not reinventing the wheel on
I almost wonder. Yeah,
I've done a good job of like building this information and this data. We need to keep using it.
I've been wondering a little bit how we could, without being like overly bureaucratic, just make that sort of partnership and communication a requirement of a contractor grant. And it's interesting to think about the people and organizations who are providing training and support in a community as we're growing the delivery systems for that as a professional development network of their own. Because there's knowledge that can be shared two ways, I think. Karen up in Washington County and I were having this conversation. The child care resource and referral agencies have a lot of information to share, wonderful data. Why would we want organizations to have to go to the expense of building their own databases? So there's a way that that can link together. And then the other organizations that could be at the table as we expand the ways that providers can get access to training also have deep knowledge to share. And so it's kind of that two-way sharing and communication. And I do think in order to prevent things from getting too diffused, we want part of being contracted with the state to provide those supports to have some requirement of regular meetings. I think communities could decide what regular means. Some would probably want monthly, some would probably want quarterly, but we are trying to build a system of professional development, and so we need to have that link to prevent some unintended.
I think that's great. Like OC, I mean, I'm very privileged to be part of the OCF T3 grant that they have, and they convene everyone who has their grants.
They facilitate that.
And they facilitate that. Are really, I think it's a really interesting model. Something like if we're going to be funding different groups to run networks, okay, let's pull together everyone who's running those networks. In that same way, that money, I would love to see funding built in so that they're not happening in isolation from each other.
Love that.
Those meetings have so many times where someone says, we wish we could do this and this, and someone's like, oh, we have that. Yeah. We have that resource, and I will email it to you tomorrow.
I like you adding that. I'm dreaming really big on this proposal. I'm putting a big dollar amount on it because if the ballot measure passes, early learning needs to take its chunk of the pie and be bold about asking for it and start high so that when we're negotiated down, we still get it. So I'm going to
thank you for letting me go off on that.
So it actually ties to the next piece, and I'm going to just make the suggestion that I talk about this next piece with the acknowledgement that we've gotten through half of the things that we're thinking about, and then propose that at the next meeting, which sounds like it will be in September, that there's a conversation about the role that community colleges have to play with child care resource and referral and other trainers and higher education. I kind of see community colleges as the hub for helping with solving some of the issues of access to higher education. And it is a 90-minute conversation, and I would not want to rush that with this group. So is that a proposal that folks can roll with? And then we can talk, Carol. Probably Margie or Dawn would be the best people to talk about that and get some perspective on it. Okay, last chunk.
Oh,
Are we looking at a cute baby?
yeah.
That's more important.
You know, I wasn't being rude. I had the picture and I hit something and I lost it. I just sitting over here trying. It ended up in the trash and I didn't trash it.
You're on.
Oh my goodness.
This was the other day.
I was going to say, if there's a way to encourage, I love how she gets the easy chair.
Right, and she's reclining on the left seat.
I was going to say, is there a way to encourage, because like story time is, book babies in my neighborhood is 11 a.m. on Friday. Once I was done with maternity leave, I was like, oh, no more book babies. And I still take Lucas to the library, but how do we encourage other community entities like the library to maybe do, have the 11 a.m. during the weekday and have the weekend hours, but also maybe do do more than just like the 11 a.m. hours or the 10 a.m. hours, so that people who do shift work or people who, there's something in the evening or late afternoon too, pick up on the rotation that happens, because we all know not everybody works Monday through Friday, 8 to 5.
We might have the juice to start that conversation now in some of the relationships, because through our room campaign, the libraries have been really like wanting to do it and have actually agreed to continuing to use room in their libraries after our funding for it ends as part of our sustainability plan. So I just wonder, like Ari on our staff has done a really nice job building those relationships. I just wonder if there's a communication channel.
I think people at the library that ask,
Yeah,
They are very.
They're so responsive and flexible.
yeah, they just want people to use the library.
Yeah, that's all they want.
Or, and it's like, like the older one, she was going to story time. Of course, the little one was with her, and then at the end of the year, they gave T-shirts out. They bought a onesie for
Oh,
you, and so these little girls, they'll tell me, Grandma, we're going to the library. We're going to the library. And that's the important part. And they love books. And so all of that's ingrained in them. Nobody will have to try to pressure them to read, because they're already doing that. And the library, has become a place where they're very familiar. That's the other thing. We, providing opportunities for the younger ones to become familiar with different institutions. Right? They go to OMSI. And so, all this, once again, my son-in-law and the family, they know that the importance of all this. Some people just don't know. I know that there are people who are not familiar with OMSI. And if you don't go on that, what is the first Sunday, whatever, one of those Sundays where it's $2 to get in, OMSI is expensive as hell to get in.
It's like $17 or $20.
Yeah, it's crazy. But, even if people just go that one Sunday a month, it's worth it. And those are the kind of things that, I like to share with parents, around little friends in the family, we talk about different opportunities.
Yeah, I met so many moms just standing when I was carrying Lucas in the carrier all the time. Like, moms that were standing right where I'm waiting for the bus with me.
Yeah.
Like, oh, where'd you get that carrier? Oh, where are you going? What are you doing? And so many moms that didn't know that the library was just down the street. Yeah. And that the Book Babies was at 11 a.m. on Friday. Like, you should come with us, you know, just show up. You know, like, I'm inviting you. This is your formal invitation. I don't have a written one, sorry. Or I'd give you one. But,
I think that's part of my thing of trying to sensitize the community to the importance of supporting the youngest of us in any way that you can. You know, if it means just sharing information or just taking time to talk.
I do think it's important to expand this opportunities for working with families too. This is kind of embarrassing that I was walking around my neighbor doing something last night while I was on. And
okay, I'm playing and I am not a mother. It's just a fun game.
And he's into it, so it's cool. But we walked by the St. John's Library. We've lived in St. John's for a year. And here's the library that we've never been to. When he was a baby, we would go to Book Babies and we would do all these things. And then I went back to work and we have 2 days to fit all these things in. And there aren't, or they don't seem to be, you know, evening opportunities that I can do these things.
even some of the adult enrichment activities are like at 11 a.m. I was like, no, I wanted to take that beekeeping class. But that's 11 a.m. on Wednesday.
We live in St. John's too, so we need to start like a St. John's early childhood group.
Oh, that would be so great.
The librarian at the St. John's Library is the best librarian in town.
Right?
Yes, Samantha is the best.
Oh my gosh, because I know, like, you know, the Multnomah County Library, we have some culturally specific story time.
And
they do. And I volunteer. I'm very good friends with the North Portland branch librarian. And I told her, I said, I would love to volunteer to come and do storytelling. Well, they had just decided that we had to go to the booth. We couldn't just say, yeah. You know me. I'm not going to do anything. But she said, no, she said that. I would love to have you. And I kind of got a little attitude. But, yeah, you know, people always talking about they don't have enough staff. And, you know, they can't do things because they don't have, you know, the resources. And then you get somebody who wants to give you something for free. And it's pretty embarrassing. But I think maybe that whole notion of an early childhood, something that the library is not responsible for, that you know, could invite people, you know, or share it with a church group or something. And just have, I mean, I'd love to work with parents and kind of share with them activities they can do with their kids. You know, teaching them poetry. My daughter was we used to do, I'd get a poem, and I'd write the lines of the poem, and then we would do a collage. And that's how she learned how to read poetry. She was 3 years old. You know, real nice, you know, didn't cost anything. And people just don't know all of the just free and low-cost ways that you can help develop a love for learning, a love for the ability to articulate what you're feeling, you know, as a child. And those are all the comprehension skills. People just don't know that because in many cases they haven't experienced that themselves. And the light bulb goes off. And you say, well, you have to start asking questions about it, you know. And it's amazing. And parents like that. They like that. They like being able to know that there are things that they can do. And they don't have to go and sit in a college class for 4 years to learn how to do it. And you can see the immediate results. That's better with so much stuff. So I like that. Early childhood. Something.
Yeah. Yeah. So the very last piece of the the kind of training opportunities that we're talking about is doing basically the same thing we've been talking about, putting dollars into child care resource and referral and other training entities for our licensed child care providers to help build out the ability to do the kind of outreach that needs to happen but that hasn't always been resourced, and to help build out the family, to keep building out the family child care networks that have been successful, where there's people clamoring to get in but there's not a spot. And the second thing is to put actual dollars behind creating language and culturally specific training at a set 2 or higher in the child care registry. This has been brought to my attention by multiple people, including Eva, that some folks have done an analysis, and there are very few trainings at a set 2 or higher, and the set 1 as well. But the one thing we're really concerned about is the ones that go beyond the sort of basic health and safety trainings being available in languages that our providers actually speak. To create that, you actually have to put some money behind it. People can't just be creating those trainings on their, like, out of the kindness of their heart as charity, which is our strategy right now. So we'd like to see some dollars behind that.
I have a question.
Yeah.
Sorry to interrupt. And I hope this is a super topic, but we've been talking about kind of culturally based networks. Are there any plans for existing networks for families and children with disabilities?
There should be, and I have to be honest, that hasn't been put specifically into our plan, but what an important group not to leave out, especially because what you need to know if you're caring for a child with special health needs or some kind of different ability is how to add that extra layer of support. So I'm going to write that down and add it. If I CP was funded to have a network of providers. So that's pretty much the scope of the training, professional development while you're doing the profession proposal, which you all have added to in a really valuable way. The final piece is just starting to put some investment into how we support home visitors, because they are early learning professionals that are part of our system, where it's really sort of just cobbled together. If the organization that you work for is affiliated with a national model, you do have access to training, but there's no sort of formal way that we're approaching that in Oregon. And we do now have infant, toddler standards and professional standards for home visiting that has been created through a federal grant that the state has, but we're not doing anything with it systematically, and so we need to start to take steps in that direction. And we have our Best Beginnings Committee has put forward pretty specific recommendations for what that looks like, and we want to just start to put some dollars behind their recommendations because they're left out of our conversation a lot. There's not as many of them. They do a pretty different kind of work, but the work that they do with families, especially families that have experienced generational trauma, is so important. There's a couple things I want the state to be thinking about that, and one is investing in professional supports for home visitors. One is continuing to invest in the service, and one is creating an infant toddler innovation fund that can be a little bit flexible, like our kindergarten partnership and innovation fund was, where we can invest in some programming that hasn't reached the threshold of quote-unquote evidence-based because it hasn't gone through like a double-blind yada yada that takes 20 years, but that we see are getting outcomes. And there are models in our state of those types of supports, and we need to start to invest in them in addition to the suite of evidence-based programs that the state has already. That's a really quick flyover of home visiting, but I just wanted this group to know that that's a group of professionals that need to get support just like child care providers and preschool teachers. And then the final frontier will be figuring out how to support parenting educators, because that's a little different from home visiting, but also a part of our workforce that has been ever been thought about by anybody but the philanthropic community.
And, we talked about culture-specific programs. We also need to look at gender. We need to look at it because there are things that little boys need to do that people often mistake as them being deviant or naughty. Yeah. Yeah. Yep. Little boys play in different ways. And ways that will sometimes make us like, he's going to kill himself. No. But it's just the way that little boys interact with the world. Yeah. And then in the same, on the flip side, little girls, you don't want to lock them into a girly world.
Yeah, encourage them to be a little bit more risk-taking and and the boys maybe dial it back.
Or even the toys that we provide.
Yeah.
I look for things for my granddaughter. And sometimes I would intentionally look for things that would not be considered girly type toys. But I look like even there's I think a Lego set. I don't know if it's Lego, and they're pink, purple. Yeah, pink and purple. Wow. But it kind of boxes them into the mindset, which serves to create a disadvantaged mentality.
I think the flip side to that too, we're thinking about networks for working with boys is you have many boys who play in a particular way and supporting that and not creating it as easy, but also supporting families and providers of boys who play in the opposite way to express their identity in a non-traditional way.
And
And how to support those children.
Yeah, absolutely. Yeah. I can remember a day time with a little boy, and it still happens now, playing with a doll, and immediately branded not understanding that.
They'd be corrected.
Yeah, boys don't play with the G.I. Joe. Boy doll, but you can play with somebody who represented violence and all these other, skills, masculine characteristics.
I feel lucky to have gotten to spend the last probably 90 minutes late sharing and absorbing the wisdom of this group. You have really deepened the proposal that we're putting together. I'm going to add these things in, and then Carol, I know that probably no one's reading all 7 pages of my policy proposal brief that I've put together, but I would like to add these things in and send to this group because you are a group that wants to do deeper analysis, and so we're not going to post that on our website because truly no one will read it, but I would like to have this group just do a deeper analysis on it.
Find it. I'm trying not to save everything in my own email, so if you post it on the website, I can go.
Well, we'll post it in the meeting minutes. Teresa's been doing a really good job of keeping all of our stuff in there. Our main website.
To try and communicate with the broader public, we probably can't put up a 7-page policy group. I guess, well, we can, but no one would read it.
So if you bury it in the meeting minutes,
you'll find it.
Yeah. So
and all of us that care about it will find it.
So I'll make sure that gets, well, Carol, I don't need to make sure, you will just do it, but I'll make sure that the thinking today gets kind of updated and reflected in there, and then we'll send it out.
I have one announcement that's not related to professional development, but you guys probably know this, maybe you've heard too, but I learned yesterday that the reservation list for employment-related daycare will be opened up August 1st. So that means anybody who's on it will receive a letter to go ahead and apply. So first come, first served till we get it filled again, which I'm sure will be really fast. Yeah, but if you know of anybody who's been waiting for care, I have several providers who said, when's it going to open up But I'm not sure how broadly that's being communicated because it'll probably happen, fill up pretty quickly anyway. But I think that we should, I think that we should be communicating that this is a subsidy that's available and that that it's very limited, but people should always sign up for the reservation list just so that we can prove the need for it, so that we can get the 300 to 350 for.
Do you have a link to mail?
Yeah,
you
can
want
we
to
put that
email
on
it to me?
Facebook and send it to listeners too?
Can I just forward you Rhonda's email?
Yes, you can.
And then you can.
I can figure it out.
Yep. Cool.
So we have 12
Yeah.
minutes. 12 whole minutes. And so I just want to open up. I know that the last couple meetings we've been really trying to hone in on what we want to do moving forward. We've turned around this idea of having people come in and talk to us and have us inform them about, or you guys, not us, you guys inform our team about where equity needs to be infused or how it's infused, and really holding people accountable for that. But since Megan is here, is there any other honing or clarification or things you want to share in our last few minutes while we have captive audience?
And I will say I know the charter for this group needs to be revised, and I've been trying to get Ms. Joyce connected with our chair to go through the early learning council chair to go through that. So that does need to happen, and everything that you have surfaced is basically what needs to go. Sorry to piggyback.
No, that's totally fine.
Yeah.
That for me is a part of, that will give us some specific direction on what we should be focused on as a committee instead of the whole universe.
If not, that's okay, because we can still, get that treated.
And then we talked about at some point down the line of coming to the meeting of the council. But I know Megan and I talked about somebody that shows up and says, "We're here, I'm here," and
I think I can make a recommendation on how to do that. First, I think that in terms of council leadership, I'm trying to convince Eva that she would be a great chair for this with Carol's support and Joyce's support. So we'll see if that can happen. But I will let you know that
You're not putting me on the spot or anything.
In September, there's a council retreat, which is the right time, I think, for the groups to be doing all of that kind of recalibrating. And it might be good to just come with a proposed revised charter and say this is how we're thinking to recalibrate our work. Try to get a vote on it, and then have that inform the kind of strategic planning that happens at the September meeting. What is that? I can't remember. We moved it because of legislative day.
Yeah.
Anyhow, we have the calendar, but I just think that could be a really opportune time. It's like the right moment in time, because those 2 days are about reflection and refocus, and we'll get the specific dates out. I just can't remember it off the top of my head.
So would it be worth having, and you can say no, having an August meeting to just dig into that charter?
Over the phone meeting. So.
Okay, we'll keep it then, and then we won't invite anybody until September, and that'll be our 2 hours of just digging, just really dig into it.
I just think the September meeting is such a great moment in time.
Yeah, if it works. Yeah. So for 8 minutes, does anyone have anything else?
I have a question about the ballot measure and just, what kind of promotion and advocacy is being done and how I can involve staff, my family, and, just get community.
I'm going to pivot to Eva because I work for the governor and she's neutral on it. And so how to get involved in the ballot measure.
Hi, yay!
Yeah.
I'll contact you. Yeah, because you can't do ballot measure